Recording in progress. Recording stopped. Recording in progress.
Good evening, everyone.
Good evening.
Good evening, Chair.
Good evening, Chairperson.
Good evening, and welcome to this meeting. It's about 1800 hours. To start with our meeting. You're all very welcome. So I'm going to open this meeting officially. This is a meeting of the Portfolio Committee. I want to welcome all the honorable members, the members from the ministry who are present, all representatives from the Department of Health, and all other guests and attendees. Ms. Majalamba, if we can just go to the attendance register, please, if you could tell us who are present, and also any apologies which we have received now. Thank you.
Good evening and thank you, Chair. Present is Dr. Jacobs, Mr. Munyai, Ms. Keller, Dr. Harvard, Ms. Wilson, Ms. Ishmael, Dr. Tembekwayo, and Mr. Van Staden. I've received an apology from Ms. Sukers and Mr. Imam Sheikh. Thank you, Chair.
Thank you very much, Ms. Majalamba. We are then now also going to give Mr. Joe Khatla, the PLO, an opportunity to tell us whether the Minister and the Deputy Minister are here on our platform. Mr. Khatla?
Yes, good evening, Honorable Chair. The Deputy Minister is on the platform with the DG, and Chair, please allow me to leave that to the Deputy Minister to announce the delegation. Thank you.
Deputy Minister?
Good evening, Chairperson, and good evening to the Portfolio Committee, honorable members. I am here with Dr. Crisp, our acting DG, and Johannes Khatla, and also Dr. Anpan Play will join us. The Minister, if he finishes on time, will also log in here. There is a meeting that is that's going on now of the Deputy President meeting with the religious leaders on the update on the COVID and the vaccine process. The same meeting that we are having, the Deputy President requested to have it with the religious leaders. So he invited the Minister to be there, and the Minister is presenting there. So we are logged in here so that we could continue with our meeting. So that's an apology for the Minister, unexpected. But if he finishes the meeting we started at 4, he will then join and continue with us in this Portfolio Committee. Thank you, Chair.
Thank you, Deputy Minister. Now, before we proceed, honorable members, I would like to remind you that this virtual meeting is deemed to be in the precinct of Parliament and therefore constitutes a meeting of a committee of the National Assembly for official purposes only. In addition to the rules of virtual sittings, the rules of the National Assembly, including the rules of debate, apply. Members enjoy the same powers and privileges that apply in a sitting of the National Assembly. Members should equally note that anything said in the virtual platform is deemed to have been said to the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when recognized to speak. This is because the microphones are very sensitive and will pick up noise which might disturb the attention of other members. When recognized to speak, please unmute your microphone and connect your video. Members may make use of the icons on the bar at the bottom of their screens, which has an option that allows a member to put up his or her hand to raise points of order. The Secretariat will assist in alerting the chairperson to members requesting to speak. When using the virtual system, members are urged to refrain or desist from unnecessary point of order or interjections. We shall now proceed with the business of the day, and today's business is what will be flighted by Ms. Majalamba, the agenda. Can you please do that, Ms. Majalamba? Honorable members, the agenda is before us. We have only one item on the agenda, and that's the update by the Ministry or Department of Health on the vaccine rollout program and vaccine acquisitions. I am asking for any member to move for adoption of this agenda, please.
I do, Honorable Chair. My name is Honorable Chidizim Yai.
Thank you very much, Honorable Munyai. Any seconder for the adoption of this agenda?
Chair, I'm seconding the approval of the agenda. My name is Honorable Anna Gela. Thank you very much.
Thank you very much, Honorable Gela. I'm now going to hand over to the Deputy Minister to inform us who will be assisting him with the presentations and any other overview which he wishes to do. Deputy Minister, you're very welcome.
Okay, thank you very much, Honorable Chair, for the words of welcome and also the responsibility that we do have to continuously update this portfolio committee that we report to on the vaccine process in the country and if there are any other challenges, and also with regards to the acquisition of other vaccines. Currently, we do have the slides mode show that we are now having a very constant sort of receipt of Pfizer vaccine. Here and there has been some sporadic challenges with the J&J, but overall, that leaves us as a country with enough vaccines. The program that we do have now is how do we take vaccines to the people so that more people can come into the program. The vaccines, as the slides might show, in the whole country, we are now having almost over 6 million people who are fully vaccinated, meaning J&J and also having a second dose of Pfizer. The slides will also show that we are sitting at just above 13 million of vaccines that have been used. So that also gives us almost about 25% of this target population, which is 18 years and above, of 40 million. We are showing, the slides will also show that we are able to zoom in per province because the minister has worked out a mathematical model that if we want to actually achieve this amount of herd immunity by come December, 70% of these 40 million South Africans, how much should we get from this district, that district, from the province, including some of the sub-districts. Hence, there's also been, the slides will show, which gets regularly updating the interministerial committee to say, Gauteng, while it is doing fairly well, but has got a big population, we want them to do better than what they're doing. Mpumalanga and Northwest are challenges there. And that is why there was also a delegation led by the Deputy President today to visit Northwest and Bojanala district in particular, to go and motivate and actually check what are the challenges they do face. There is still that determination that we are saying the bare minimum is 250,000 to 260,000 per day, so that at least we can comfortably say we are getting about 1 million in a 5-day week cycle. That will take us into close to the 15, 16 million if we are counting that we are left with about 16 weeks into the end of the year. And if we do 1 million per week, then we are closer to doing and getting to the number that we are requesting. So that is just what the slides will show, and therefore will be, Dr. Nicholas Cripps, our acting DG, will take us through those slides. We will then still be available to clarify, answer questions, and take advices as when the members do interact with us. Thank you very much. If you do then allow me, Chairperson, I will hand over to Dr. Nicholas Crisp, our acting DG, to take us through the slides.
Thank you. You're welcome, Honorable Deputy Minister.
Thank you very much, Chairperson. Good evening to you. Good evening to the Deputy Minister, members of Parliament and colleagues. Just also to note that I've got two other senior colleagues from the Department of Health at the meeting with me, Ms. Annalisa Cele and Dr. Barry Kistensamy are also here in the meeting. If I may share the presentation that we have prepared, I hope it is coming up on in the correct mode. Should be there for you now. So thank you very much for allowing us this opportunity to share the progress. We recognize that numbers are very confusing and sometimes it's difficult to understand exactly what the department is saying. So I would like to go quite slowly through some of the issues of today. We're going to deal with 4 points in this presentation. One, as the Deputy Minister has alluded to, about vaccine security. How much vaccine do we have? And what is it and where it is, and I'll talk a bit about that. The second issue around the progress with vaccination. The third one is our insights we have at this stage into whether vaccines do make a difference. And the last one, talking about demand generation, which the Deputy Minister has referred to. So in terms of vaccine security, we are in a very strong position at the moment. So it's either feast or famine for us, it seems. So what we are seeing at the moment is a situation where we have, in Q2, received these vaccines, 2.8 million of Johnson & Johnson, Pfizer vaccine of just under 4.5 million, plus another 1.4 million, just under 1.4 million from the Pfizer COVAX. And now in Q3, we're looking at the schedule of deliveries should take us into 3 different deliveries again. We are expecting 9.1 million doses of Johnson & Johnson, 16.5 million doses of Pfizer, and then Pfizer COVAX donations, which we get from time to time, another 7.87 million doses is scheduled for us from the COVAX donation. And these figures go through into the fourth quarter, so that you can see that we will have expected in the year to have received 31 million doses of Johnson & Johnson and 30 million doses of Pfizer. I think everyone knows that we have not received a lot of Johnson & Johnson up till now because of the challenges that we're experienced globally with the shutdown of the plant in the United States. And that's why you see such a large number of Johnson & Johnson doses expected in the fourth quarter. That's because the deliveries have now started coming through a little bit slowly at first, but we are starting to get schedules, and this is what we're expecting to see. Now, what we do have at the moment in terms of our weekly schedules is in the week of the 6th of September, 2 deliveries, Johnson & Johnson of 1.4 and another of Pfizer of 1.556. So we're quite excited that the Johnson & Johnson vaccines are now starting to arrive. We are expecting on Friday night or Saturday morning another 1.36 Johnson & Johnson. And then the schedule that's been supplied to us through the month of September and into October is looking good. And we certainly hope that that will sustain the capabilities of the Johnson & Johnson portion of our rollout program. We continue to receive Pfizer vaccine at 1.5 million doses once a week, but we have a surplus of capacity at the moment with a lot of vaccines sitting in our central stores and sufficient in our pipeline, both for first and second dose vaccines. So what we have done is we have shifted out some of the deliveries so that we don't accumulate unnecessarily vaccine, and also so that when we do get vaccine deliveries a little bit later, maybe towards the end of October or into November, those vaccines will have a later expiry date, and we don't run the risk of getting vaccine now and then its expiry date is too soon and we're not able to use it. The bottom line, Chair and members of the Portfolio Committee, is that we have sufficient vaccine in the country at the moment to last us for 2.5 to 3 months, notwithstanding what's still coming. In terms of our vaccination progress, what we have as of yesterday, which is the 8th of September, one can see here in the timestamp, was at 4 o'clock yesterday afternoon. We had vaccinated 14 million doses of vaccine. And that is made up of just over 3.1 million doses of Johnson & Johnson vaccine and 10.9 or just under 11 million doses of Pfizer vaccine. The Johnson & Johnson vaccine was the initial 500,000 doses, of which we administered 490,533. in the Sisonke program. Now, those who have been watching the figures will notice that this figure has gone up, and that is to do with the reconciliation with paper records that were discovered after the 17th of May, when the program was closed. And we didn't include them daily as they were being captured, because then it just messes up the figures and makes it very difficult to explain. We waited until we think we now have all of them captured, and this is the sum total of the vaccines given during the Sisonke period. One can see where those vaccines were administered in the population across all 9 provinces, and more or less in relation to the population sizes of the provinces. Since the 17th of May, we have vaccinated 2.613 million Johnson & Johnson vaccines. This is the 1.5 million that we got with the short expiry date, plus some other vaccines that have been delivered since then. And the distribution of the administration of the Johnson & Johnson vaccines in this period since the start of the rollout is shown in the bar charts below. Again, more or less in proportion to the population sizes. We are targeting Johnson & Johnson vaccine very particularly to the SASSA pay points because it's difficult to get hold of some of those people again. And we are also very deliberately targeting Johnson & Johnson vaccine to rural areas, especially those with vast distances between communities where it's hard either for the services to get out with the mobile clinics or for the public to get to sites that are relatively near to them. So there's been a focus on rural populations, and you'll see the catch up in the rural areas of KZN, Limpopo, Eastern Cape in particular, but also in the rural areas of Western Cape, Northwest, and so forth. As far as the Pfizer vaccine is concerned, here we are interested in first doses and second doses. And the first doses get followed 42 days later by a second dose. We are hoping to get an uptake of second doses in the vicinity of 90%. It's very rare that one would get 100%, but we are pushing to get these doses of second doses of vaccine after 42 days from the first doses. One can see the distribution where the green bars in this chart show the first doses, and the gold bar portions of the bars show the second doses of Pfizer vaccine. I will talk about fully vaccinated in a moment, but for completeness sake, the second dose of Pfizer vaccine plus any dose of Johnson & Johnson vaccine is what we regard as being fully vaccinated. So that is the sum that the Deputy Minister was speaking about a moment ago, 6.7 million people who are fully vaccinated at this stage. So the vaccination progress is rather up and down. I think everybody knows that on the 21st of July, we started to run out of vaccine in many vaccination sites. We had expected Johnson & Johnson vaccine and a delivery of Pfizer, which were not as on time as we had expected. The Pfizer dose was still being discussed with COVAX, but Johnson & Johnson vaccine was due and was not delivered for some time after that. And so we lost momentum in the program. And one can see what happened. This is Gauteng on the red line, and then KwaZulu-Natal on the dark blue line, and all the other provinces. There's the Eastern Cape in yellow. And one can see that all provinces lost momentum, perhaps except Northwest, which ticked along with a minimal decrease, but at quite a low level of their program. Then we got vaccine, and we got opened up the vaccination program to the youngest population of 18 to 34, and the numbers took off quite rapidly. And then the weekends again are reduced. That's why you see these dips. That was sustained over the following week and has now started to decrease again once the enthusiasm of the new age group decreases. Fortunately, we are still seeing a lot of older people being brought by their family members and I guess friends in the lower age groups. So we are catching up with the numbers in people over the age of 50 and over the age of 60. The graph on the right-hand side just shows the cumulative numbers in each of the provinces. And on the left-hand side, you'll see the time period that this is reporting on. So it's from the 1st of July until the 8th of September is what is reflected in this particular graph. As the Deputy Minister indicated, we're not only interested in chasing numbers, we want to know what proportion of the people that are part of our target group are we reaching. So the idea is to measure it, you can measure it as percentage, but we tend to measure as vaccines administered as a portion in relation to every 100,000 people. And the Western Cape has 46,000 or 46% of the population has been reached with a vaccine. And we see that in Mpumalanga is only on 24,841 as of 4 o'clock on the 8th of September, yesterday. So the concerns are in these provinces that have had relative to the other provinces are lagging behind. In particular, the provinces that concern us are Mpumalanga, Northwest, and Gauteng. Their challenges are different, and the issues that we are having to deal with to assist them to accelerate the vaccination programs are different. I'll go into a little bit of detail about that. So what we also measure is not just how many vaccines, but how many people are vaccinated. And one can see that the total number of people who are individuals who are vaccinated is 10.321 million as of yesterday afternoon, 4 o'clock, recorded on the system. The system updates again until about 7 o'clock at night. So it will have been slightly more than that by the end of the day yesterday. And so that's people. So we had 13.5 million vaccines, 10 million people, and 6.858 fully vaccinated. And as I indicated, that means that they have had either one dose of Johnson & Johnson or 2 doses of Pfizer vaccine. Now, what the Deputy Minister was referring to is inside the provinces and inside the districts, we have quite different levels of vaccination coverage and numbers of individuals vaccinated. And what we are doing is we are following very closely which municipalities, either at district level or local level, are lagging behind, and trying to understand what the factors are there. It's not always access that it's a factor. Sometimes it is hesitance or just a failure to really motivate that community. And there are different ways to motivate different communities, whether in rural or urban areas. And we'll talk a little bit about demand strategy in a moment. So you can see the individuals vaccinated are slightly different in shape from the total number of vaccines given. And looking at the timeline from March or the end of February, 17th of February, when the program started in Sosonke, through the 17th of May, when the national program started to roll out, one can see it started to pick up, and then we had this dip. Now we are concerned again because we have started to see another dip now that the younger population's initially motivated portion is not coming for vaccination. What is also of interest, we have reported before that men are vaccinating less than women. I'll start on the top right-hand side here and show that this used to be somewhere around 37 or 38% of the population that was vaccinated was male. It's now sitting at 42.23, which means that the men are coming for vaccination, and we are starting to see some catch-up. Last week on Friday, this was 41%. You have to do quite a lot of additional proportion of male vaccinations before you see that level of catch-up. So that is one thing that is encouraging. Men are responding to the call to vaccinate. On the graph on the left-hand side, one can see the actual numbers of vaccinations in each of the age groups. So in the 60 plus, 1.917 million women, 1.23 million men, and so it goes down. And you may ask, why are we seeing 10 to 19-year-olds vaccinated, 58,000 and 46,000? These are mostly health sciences students who work on the vaccination program or in the clinical ward. So they're 18 and 19-year-old health sciences students working in the clinical programs. but there are some employees in the public sector who were vaccinated, and a handful in private sector employment who are part of this vaccination as well. We're not seeing a lot of people under the age of 20 being vaccinated at this stage. But we will watch that this increases the 18 and 19-year-olds in the weeks ahead. The percentages of that relate to these numbers are just shown in this same proportion graph or pyramid graph. And what one wants to see is that the age groups with the larger populations widen over time. So where we are at the moment is looking at age groups. Our biggest target or primary target is to get older people vaccinated, because they are the ones who get the most severe infections, end up in hospital, end up in intensive care units, and who end up dying more than anyone else. And our statistics have shown repeatedly that by reaching this population, we can decongest the hospitals and save lives. So it's encouraging that both of these age groups are vaccinating. And in fact, the 60-plussers are now, as a portion of that population, in excess, in some provinces, way in excess of 60% of the population is vaccinated. Obviously, the challenge now is to get the younger population enthusiastic and coming for vaccinations in large numbers. So if one looks now at the individuals vaccinated rather than the total number of vaccines being administered, we start on the graph on the left-hand side. The population in this portion of the total population of the country is just under 40 million. So for ease of numbers, let's call it 40 million. Where we are at the moment is 10.3 million individuals vaccinated, and we would like to see 70% of this population, of the adult population, vaccinated by the end of the year. So that's the primary target for the Department of Health and what government is pushing. And the red box is the remaining portion of the population we need to get to. So close to or around about 19 million is the target of individuals, not vaccine doses, but of individuals. Remember, we are giving vaccine second doses to a larger and larger number of people because our program is very dependent on the Pfizer vaccine. When we start to introduce more Johnson & Johnson, when the deliveries increase, it becomes easier to reach fully vaccinated individuals because you only need one dose. But at the moment, we're sitting at just under 7 million fully vaccinated individuals in the adult population. So looking at percentages, 25.93, or just over a quarter, 1 in 4 of the total adult population in the country is currently vaccinated with at least one dose, with the Western Cape already at 1/3 of their population already vaccinated, closely followed by the Eastern Cape. That figure might be difficult for you to read, but it's 30.53, and then followed by Limpopo at 29.44 and Free State 27.77, Northern Cape at 25%, and then the others less. As I indicated, our concerns are with the stragglers, particularly in Mpumalanga and Northwest, but Gauteng will always be a big target for the health departments because the population is concentrated there, and so it's low-hanging fruit if we can get to a large number of people in a short space of time. The fully vaccinated individuals, one can see that the 3 provinces who are doing the best are still the Western Cape, Eastern Cape, and Limpopo, closely followed by the Free State and the Northern Cape. And the Northern Cape, if you may recall from previous presentations we've done, was lagging behind. But because we are now preferentially giving Johnson & Johnson vaccine into those difficult to reach areas, their system is picking up quickly and they have caught up very well. We're very happy with the progress that they've made in the Northern Cape. So the takeaway message is that we have 10.3 million adults vaccinated, and that's a quarter of the adult population vaccinated at the moment with at least one dose. But for Pfizer, we want to have a second dose. The coverage of the total population of the country. So now changing the denominator from 40 million to 60 million, 59.797 is the official stats figure that we're working on. Obviously, then, because we are not vaccinating that other 20 million child population or under the minor population of the country, the coverage is only sitting at 17% of the total population, with the Eastern Cape and Free State being at 18% or thereabouts, and also Limpopo and the Western Cape at 23.96. Now, we've previously indicated the challenge that we have, that the insured population has easier access for a whole wide range of reasons, has easier access to vaccination, not only because there are a lot of private sites that medical aid patients can get to, but because they have transport and they are able to get to these sites more easily than the unvaccinated population. So we're seeing almost a third of the whole country of insured population vaccinated, whereas we're only on 14.5% of the uninsured population. Notwithstanding that, there are provinces that are doing extremely well with 18, 17, and 16, or almost 17% in the case of Limpopo, percent of the uninsured population vaccinated. This is a big target for the public health departments of the provinces and for the national department. So just before I end I just wanted to speak about, do vaccines make a difference? What are we learning? I apologize, the slide's a bit fuzzy. We are still working on this dashboard. But on the 5th, the data that we were looking at on the 5th of September, because we are trying to build a picture of who is getting infections. Is it people with vaccinations or not? So on the 5th of September, there were 11,205 people in public and private hospitals in the country. 1,956 of those people had had a vaccination, one at least, and 9,249 had not been vaccinated. So your chance of ending up in hospital unvaccinated is in a ratio of 83 to 17. Then the question is, if you are in hospital, how sick do you get? And of those 11,205 that were in hospital, 767 were in high care. Of the 767, 129 were vaccinated. Remember, at least one dose, so not necessarily fully vaccinated yet. And 638 had not been vaccinated. So again, the same ratios we saw as in hospital, of 83 not vaccinated to 17% vaccinated. If we look at who was in intensive care unit, there were 161 people in intensive care units around the country on the 5th of September. 325 had been vaccinated with at least one dose, but 1,286 had not been vaccinated. So again, it tells us that 80%, the chance of being in intensive care unit is far higher if you're not vaccinated than if you've been vaccinated. And what we are busy analyzing is over a longer period of time with a larger number of data, how many of these that were vaccinated had had only one dose, where we know that one dose of Pfizer does not give full cover to keep you out of severe illness. And we will be reporting on those figures in the near future. But this already tells us, do vaccines work? Yes, they do work, and they're very effective for keeping you out of hospital. The last slide I want to go to is talking about demand generation. So as I've indicated, we have a lot of vaccine in the country at the moment, more than we need, in fact, for the immediate future. And what we need to do is get people to that vaccine and get the vaccine to the people. So there are a number of broad strategies which have a lot of detail to them, with a very detailed plan for each one of them. But I'll just go through the highlights. The first one is to increase visibility. And that's the simple stuff like signage and posters, making sure people understand the messages and know where to go to get to a vaccine site. They mustn't be hidden away in places. This includes improving the information available on the websites so that people know where the vaccination sites are. And all the time, we're trying to give better directions to everybody to know where to go. This is public and private sector. Everything I'm speaking about is public and private sector, because we're working very closely with the private sector, and nothing is done differently. They may brand their own things, and the provinces might brand their own sites with their logos and so forth, but it's the same program. The second one is to put information into people's hands. We need people to understand what vaccines are about, either in written word, websites, social media, whatever mechanisms, explaining what are vaccines about, that they're not medicines, they don't treat, but what they do is allow your body to generate immunity to fight off the exposure to the vaccine. And then what to expect in a vaccination process. There are a lot of people, surprisingly a lot of people, who are afraid of needles and who are afraid of going into spaces where we have the vaccination programs, and they really want to understand what happens in the vaccination process. Then where to go, what happens after vaccination. There are quite a lot of side effects. They nearly all mild. Some can be a bit severe, and you can feel a bit lousy after vaccination. And people want to understand that information. And so we are printing pamphlets, putting it on radio, talking about it on community radios and so on. And then the contact center where people can phone in and ask their questions and have those questions answered directly. The third major strategy is around the use of local media, not just national media, where some of us talk on radio stations and talk to the national newspapers and other digital media, but use of local community radio. It allows us to use the vernacular of a local area and to use particular words that have more meaning to people in those communities. We found that community radio is extremely powerful for getting messages across. And then engagement with the other media at local level, including print media and even using social media, but in small WhatsApp groups and so forth. Then there's the local canvassing and mobilization. This is probably the most effective of everything that we can do. And that is to get the local leadership. And when I talk about leadership, I'm talking everyone. Traditional leaders, community leaders in local government, sports leaders, healthcare leaders, youth leaders, the faith-based organizations and churches and so forth, all of them. Anybody who has some kind of status within a community makes a big impact on people's willingness to come forward and be vaccinated. There are a number of non-government organizations, some very big ones, who are extremely effective and very helpful in mobilizing and canvassing, and we're trying to get to work with more of them. The community health worker networks, this is why the rural provinces have done so well, because they have a lot of community health workers. Some of them are employed by them within the departments on various contracts, but a large number of community health workers and community development workers, in fact, work for non-government organizations. They've been extremely effective in mobilizing people because they work door to door in any case. And then there are a range of other local networks that are unique to each community. Then access strategies. This is the outreach where we are trying to use more vehicles to get to pop-up sites, to use the existing mobile that are available. Even the emergency medical services are used at times when they are not busy with those services, and to use client transport, both public sector client transport and private sector, but especially private sector. And there's been a program running in the last couple of weeks using Ubers and municipal buses and so forth in 7 urban locations to try and take people to the vaccines if we can't get the vaccines to people. And then individual communities and people have come up with a whole range of ideas that are being explored. And at the moment, we are working with particularly sports and cultural organizations, artists, and so forth, with a whole wide range of quite exciting ideas about how to generate demand. Thank you very much, Chair.
Thank you very much, Dr. Nicholas Crisp, Acting DG of the department. Anything you want to add, Deputy Minister?
No, not for now. Maybe when the questions do come up, we may come back. But for now, thank you very much.
Thank you very much. We appreciate what you were saying. Two things I just want to mention. And that's the one that actually the sentence you are saying that people through being vaccinated, we can have our hospitals decongested. That sounds really very good. And I really like that sentence from you. Secondly, that it is clear from the figures which you are showing that people who are vaccinated, even after having received only one dose, have an 80% chance of more versus the 20% chance of those who are vaccinated, and 80% of those who are not vaccinated of actually landing up in ICU. That is very, very significant. And also people just landing up in hospitals, the same. People who are not vaccinated being at 83%, and those who have received one dose or partially or fully vaccinated at 17%. So those are very important statistics for us really to get out to the public, to get an understanding of the importance of the vaccinations. And having said that, there are a number of honorable members who would like to ask questions. And I have a list of the honorable members. First would be Honorable Gela. Secondly, Honorable Churwa, and her questions will be asked by Honorable Tembakwayo. Number 3 is Honorable Munyai. Number 4 is Honorable Ismail. And then I see Honorable Tembakwayo also raised her hand at number 5. So I'm going to put the order like this. It would be Honorable Gela, Honorable Munyai, Honorable Ismail, and Honorable Tembakwayo. And Honorable Tembakwayo would also be asking the questions of Honorable Churwa, who is having difficulties with her connections. In that order, please raise your questions, honorable members.
Thank you very much, Chairperson. Firstly, let me welcome the report. I know that the department or the minister and the deputy minister, they always update us as portfolio committee about the vaccination, the progress, which we welcome that as portfolio committee members. Coming to the issues that I want to raise, Chairperson, I've got a number of questions that I want to ask to the department. My first question, DM, is it true that most of companies, they are going to make a vaccine mandatory starting from next year? They are going to apply that as a mandatory policy in their companies. What is your understanding in terms of that matter? Or and the other issue, as we know that President said, people, they have a choice or a right to choose it or not to be vaccinated. And then the other question, Chairperson, I just want to check what is the official position for government on a mandatory vaccination. My other question, what is the level of a harmful event reported to the National Department of Health, given the vaccination process? The other one, how was this adverse or harmful events being resolved or handled by the department? The other one, by when will the under 18 be vaccinated like it happens in other countries? We know that we have already started with other categories, but if we can also get understanding, when are you going to start vaccinating under 18? The other question, what is the most pressing challenges that bothers the Department of Health in terms of vaccination, and how is being responded to? The other one, Chairperson, I know in slide 11, that shows that almost 10.318 million people are already vaccinated, but we still have the target that at least we must make sure that we vaccinate 40 million. I just want to check how is set aside for proposed vaccination campaign, the budget that is put aside for that, so that at least we also do campaigns and we popularize that, we encourage people that they must go and get a vaccine. The last one, Chairperson, I think we note that the department have a vaccine that will last for 2 to 3 months, but we'll also get an update as how to also going forward. But so far, I think DM, we really appreciate siyabonga futhi sithanda nokugqugquzela abahlali basemzini Afrika ukuthi masiyeni sogonywani sizokwazi ukuthi sivikeleke. Ndiyayazi ukuthi khona ngoku sisondelene ukuthi siye kwi-holiday ze-Christmas, masenzeni sure ukuthi siyazivikela, sivikela nabantu esibathandayo ngokwenza sure ukuthi siyahamba siyogonywa, sigonyelwe lesi sifo esesibulala abantu esikhona ezweni lakithi. Ngiyabonga kakhulu Chairperson.
Chairperson, am I the second one?
Yes, I was going to allow you number 5, Honorable, so you can do both questions then. Honorable Munyai next. Honorable Munyai.
Coming in, Honorable Chair.
You're welcome. We cannot hear you, Honorable Munyai.
Thank you very much. I was trying to switch off the noise of the TV so that when I speak, it should not interfere with the system. Kuyintokozo kakhulu kuthina. Sibona umsebenzi omkhulu oyenziwa i-department nabonke abasebenzi nabaphathiswa bezempilo, uminister uPhahla, and as well as nomphathiswa udokotela ubaba uDlomo. But what we want to do, Honorable Chair, on my part is that I think we need to encourage and congratulate you for the work that you do. We know the target, the work that needs to be done is still high. I've seen that target that DG Chris was trying to indicate in order to vaccinate our people. But, you know, and also the intervention of using the local radio stations, that's a very good work. But the key issue that I think we need to call, because you know the vaccine should not be limited to have the vaccine champion only in the minister and the deputy minister. We'll continue to make this call that all our people, all our leaders on the ground, Amakos, your traditional leaders, all community leaders, faith-based leaders, they must be the leaders to mobilize and organize our people, especially to combat the media propaganda, which speak about the myth and not science about the vaccine. So we need to congratulate you and make sure that it's all our work, not only the work of the ministry and the department in general, but all of us as leaders within communities. We must also sing the song to mobilize our people, our community to vaccinate. And I'm sure the point has been made over and over and over based on science that our people, vaccination of our people, it will protect them against severe illness, hospitalization, and amongst others, death. So it should be, I repeat, Honorable Chair, that our national duty and our moral obligation that all our community leaders cross across the country should be we should find the vaccine champion. And we must also have mass education, because the mass media campaign, I've seen that in local community radios, to be able to encourage our people to vaccinate. But also, we should come strong to combat what thinks is the myth and undermine the project to vaccinate our people. So let's congratulate once more the DG and also the administration and the team and the ministry, the minister and the deputy minister, for the hard work that is before them. But they can't achieve this work alone. We need a partnership with organized community, organized labor, organized business, organized community constituents, as I said earlier, to make sure that we mobilize our people. However, it will require a very strong program. Very strong program. We need to reach out to our people. Like I said earlier, the project the campaign that's being, taken forward in KwaZulu-Natal, Operation Sabalanda, Operation We Are Going to the People. That is the only campaign that will help. Because we know that majority of our people are unemployed and they are also in the abject poverty. So it's important that we find mechanism that how best we go and reach out to our people. If we are to reach the target that Dr. Crisp, acting DG Dr. Crisp, would have indicated before the slides. Thank you, Honorable Chair.
Thank you, Honorable Munyai. Honorable Ismail.
Good evening, everyone, and thank you for the presentation. Just give me 1 second, please. Okay, I just have a few questions. Sorry, I'm just... Okay, so what is government's official stance on mandatory vaccinations? My second question, have there been any instances of government paying or compensating families or individuals that have died or have had serious adverse reactions? My third question, how many Pfizer vaccines have been spoiled as a result of storage or transport reasons, considering its storage requirements? And my last question, will government publish an official and easily accessible list of medications that are known to have serious adverse reactions with Pfizer? Thank you.
Thank you, Honorable Ismail. Honorable Tembakwayo, and I see a hand of Honorable Sukacha up after Honorable Tembakwayo.
Thank you, Chairperson. I just would like to start with my question to the Minister. I wish he was available, because the question is based on the mixed reactions to statements that were made by him, suggesting the government is considering limiting access to public facilities to those who have not been vaccinated against COVID-19 and allowing the business community to do likewise. I just wanted to hear from the Minister whether he said this and why did he say this, because he is failing to provide us with the vaccines here. But now he's meddling with other things that will make him look very unpopular to the South Africans. I mean, it's a contradictory statement to what the president have said. So I just needed clarity, and it's not a good statement that he is making, a Chairperson. And then let me continue and read Honorable Chirwa's questions and questions to the Deputy Minister and NDOH. And the first one reads, 1, update on the devised program following recommendations by committee in previous meetings on alleviating vaccine hesitancy. Number 2, Are we going to reach the 67% of our population vaccinated by December? 3, with DG Sandile Buthelezi on suspension, citing involvement in digital vibes and resignation of former Minister Zweli Mkhize, what is the reason Dr. Anban Bilay is still around? And is the minister and the deputy minister aware of any report and or investigations involving Dr. Alban Pillay? What is the principle applied on DG Buthelezi's suspension, and why isn't it applied across the board on officials involved? 4, a request to Steve Biko Academic Hospital to intervene on the healthcare of 7 women, part of the first sterilization cohort in the ministerial committee, was sent late August, but wasn't fulfilled, voting that dual processes would be problematic. Past few days, EFF shared list with the minister as well, and to date, there hasn't been a commitment to assist the women with medical intervention. What is the department waiting for to give these women their right to quality health? Why hasn't there been an attempt to retain commitment to provide medical health care for all of them following the first workshop with the ministerial committee earlier this year? Thank you, Chair.
Thank you very much, Honorable Sukacha.
Thank you very much, Chairperson. Let me also welcome the report from Dr. Crisp, and also welcome our Deputy Minister. Just two questions from my side, Chairperson. The first one just want to check from Dr. Crisp that what is the progress in as far as the targets that the department have set itself to reach in as far as the vaccination process is concerned? Are we reaching our targets? Are they reachable? Will we be able to reach them? Then the second one, Honorable Deputy Minister, I really want to applaud yourself and the Minister and the department and the Deputy President for the progress that we are making in terms of mobilizing our people. It's a very good move. You have moved in Gauteng, I've seen it. It's a very good program. You were in the Northwest, a very good program. A very good program. A very good program, and I really applaud the department for that. I just want to check, Honorable Deputy Minister, what is your program? Are you going to visit the rural areas? I'm very worried about our rural people in the villages who cannot come to the centers where the activity is. Will that program of the Deputy President and yourselves and the Minister also be extended to our villages? Thank you very much, Honorable Chair.
Thank you very much, honorable members. I also have 2 questions for the Deputy Minister and for our acting DG. Having noted the dips over the weekends and the huge discrepancy between provinces in terms of the numbers of vaccines administered per 100,000 people, and noting your points on demand generation, addressing access, etc. The question is, how are we going to address the challenge of vaccine hesitancy? And what is the role of that hesitancy in terms of the numbers to be reached? I think it would be a serious challenge, and it's a very serious thing that we need to address as soon as possible, so that people need to understand the importance of having themselves vaccinated. And I raised it earlier from 2 points from your slides about landing up in hospital and landing up in the ICU, etc. So if you can just maybe tell us how are we going to address the challenge of the vaccine hesitancy. And my second question is that at first I had thought that the number of people to be vaccinated was to be 39 to 40 million people, which means 40 million, 70% of 60 million people. And I know what you're saying in one slide that we are talking about 70% of 39 million people. The question is whether there is a shift in thinking about the numbers, or are we looking at different timelines for reaching population immunity? What has happened in terms of the numbers which are projected now? And honorable members, those are the questions which we wanted to raise. I'm now going to hand over to the Deputy Minister and to Dr. Chris to answer those questions. Thank you. Deputy Minister?
Yes, sorry, I was just trying to get in the right space here. Thank you very much for those comments. And let me start by thanking you, Chair, for picking up a very important point that says, from that slide that was presented by Dr. Nicholas Crisp, that even with one vaccine done, if it's Pfizer, you are almost 80% protected. So you may still be admitted to a hospital, but chances of you getting into the ICU and maybe not coming back from the ICU are much slimmer. As he is saying, that report will then be completed in the next. How many of those that went into the ICU, vaccinated or not vaccinated, succumbed to the illness? And so that will be a very interesting information to have. There's one question, the first one asked by Honorable Gela is almost similar. First question of Honorable Ismail, and to say, is the government going to be considering mandatory vaccination? For now, the president has announced no, we will not. However, for those companies who are actually making it, and like this morning, I heard that the medical deans are saying medical students will have to be vaccinated. And they give their reasons to say, we do not want the students to lose out on time. They are working with patients, they are going to the wards, and they are almost up. So they are almost saying medical students, some of them, especially the clinical years, are similar to the healthcare workers. So we should make that is their stance, and probably one can listen to that with a bit of understanding what is informing them to say so. There will be certain private companies who are thinking they should actually say, I don't want to lose productivity. I would want to have all my workers vaccinated, and therefore this is how I wish to conduct it. The government has not made any pronouncement on its vaccination being mandatory. However, we are not able to indicate and stop anybody who wishes to have it that way. So that is the stance of government at this level. There is a committee on the harmful events or side. There is a committee that is where maybe Dr. Nicholas Crisp will come in. There's a committee that is working on serious adverse events or just on adverse events. That continues to advise and guide and give us a detailed response. I have not been seeing that recently. That tells us that these are the events, these are serious events that have taken place, these are the other events that have taken place. This is the process of monitoring those South Africans. But again, the onus is still on me and Dr. Jacobs and everybody else to have been vaccinated to come back report if there's any matter. We can only pick them up if our clients, our participants do come forward to report, and then that can be recorded and be followed up. There has not been any, Honorable Gela, any indication that we'll be vaccinating any South African who's less than 18 years of age. The vaccines that are registered are for South Africans and for the whole people in the world who are 18 years and above. Therefore, the vaccination to the younger people is not been actually part of the program that we are doing. That is why maybe it answers a bit on the question that is raised by Honorable Chairperson, where we are probably having close to about 58 million South Africans, but the population that is 18 and above in the country is 39 million, let's round it up to 40 million. That is the population that is saying if we can vaccinate 70% of that 40 million, that is what now we're working on, rather than say if we vaccinate the whole population. No, the whole population of the adult population. Honorable Kela is asking, what are the pressing challenges that the department or the country has in terms of the vaccination? It's probably related to another question asked by the journalist that are the local government elections not going to impact negatively on the vaccine program? The truth is no. In fact, we have actually understood that the local government election preparation is a very important campaign that must go parallel with our vaccine program. We would like to speak to the honorable members logged in here to say, while we will be going out there as Parliament rises on Friday, talking about preparation for local government elections, please do ask South Africans to also consider vaccinating. That is an important program. So we think it will also enhance, because it will be your door-to-door, your visits to people to go in there and speak to them. The vaccine hesitancy is probably something that also Dr. Chris will talk about. There is not a very strong belief that we have a vaccine hesitancy vis-a-vis just vaccine postponing, when do I get it? I mean, somebody was even saying, if you were to say vaccines will be finished by next week, maybe you'll see a lot of people coming in to vaccinate, but we won't do that. We just think that the hesitance that you see is people saying, look, but there will be some other time I'll go to. Because when we go to door-to-door taxis, we see the uptake being very good. So the vaccine hesitancy, but we don't want to undermine it. There are programs and plans to improve it, going to door-to-door, visiting people, go all over where they are and speak to them. Just this afternoon, some of us in Bojanala were in the in the farms where we saw the farm workers, and we wanted we're speaking to the farmers. Say, thank you very much for allowing a day off for your farmers, for our farm workers to come into this to be vaccinated. We don't take that for granted. But however, we were saying those are areas that are difficult to find, where you probably need to have a Johnson & Johnson more than Pfizer, because you know that once I'm done here, I've gone. The rural areas, the most difficult to find. Farmers and farm workers are the area that we're going to. So I think this also goes to what Honorable Ishmael asked about the mandatory vaccination as a plan of government, which is not on that. And this question is coming again, asked by Honorable Ishmael, but I don't know whether it was asked by him the previous time, whether there is any plan to compensate people who have got serious adverse events in that part. That part, the answer is no, until and unless there has been a report and showing that it was actually due to this and that vaccine. But maybe Dr. Crisp, you probably might also add on that, was you probably know and stay longer in the department than I have been. If there's been any report also on the side effects on the medical, if we do indicate what are the side effects that are related to a vaccination with Pfizer, do we tell that to our South Africans before they come? Please, can you come on that, Dr. Crisp, and then indicate? I want to say to Dr. Tembekwayo, I was not aware of the statement that you said came from the minister, and therefore it will be difficult, but we'll relate that issue that you are saying. It looks like there was a mixed statement released on saying we'll limit access to the public in those areas for those who have not vaccinated. So that part I will have to raise with the minister. I will take it to him and maybe assist us with the response, because I'm not aware of. Let me come to the questions that were raised by Honorable Chirwa. Update on the device program following recommendations by the committee. Are we going to reach 67% of our population by December? That is our wish, Honorable Chirwa. That is why we're working so hard. We are visiting various provinces where we see that the number, because what we are actually saying, honorable members, if we can vaccinate 260, if we can have 260 vaccines per day, per week, which is a 5-day cycle, you'd obviously be more than 1 million. So if you then calculate from now and look at how many weeks we have by December, having about 16 weeks, we will then definitely have about 16 million South Africans if every week we do just 1 million or more. Now, if you use here and there some weekends, so if we were to have things as they are, where we are getting about 260, somewhere we're being asked, why are you reducing to 260? That is where we are still at. The president has asked that we move it to 300,000. So if you can really push and have 300,000 per day, then we are almost in 4 days having 1 million. Every 4th day having 1 million. Of course, safe to have weekends. Now, there's an issue that was raised with regards to the DG Buthelezi, who is currently not with us, and why is an issue about other employees. Let me just put it this way. The investigation in the department and the report about other officials is a work in progress, according to the information I have with the minister. It is you can't ignore an SIU report, but there will be processes for it to be engaged in by the department. There's nothing that will be hidden, honorable members. We will come back to you on that part. The issue of Honorable Chiro about sterilization, 2 days ago, we were briefed by the officials of the department to say, Minister Pasha, the report on the findings of the forced sterilization of those women is now ready. The minister actually started a committee that was independent of the department, that was led by a gynecologist focusing on this process. So we were then being refreshed as minister and deputy minister. What was the report all about? What is it going to say? So once, honorable members, we received that report from this leader gynecologist who was mandated to, we will then bring it to you to share. There's nothing to hide, but it is not easy and possible to implement the findings of the report and process it before it is given to the minister. So maybe those are some of the issues that were raised by Honorable Chira, that this report, once completed, it will be brought to the attention of and reported to the portfolio committee. Honorable Sokacha is the progress on target. Honorable Sokacha, is it reachable? I think maybe somehow the question has also come in that say, is it reachable? Our desire is that if we stick to above 260,000 per day, we will get there. We were very encouraged when we visit the Gauteng. Gauteng, by the way, alone is doing 75,000 vaccines per day. And when we were speaking to the MEC, Dr. Namathemba Mokheti, she was saying she's really pushing herself and the department to do closer to 90,000 vaccines per day. So if you can get all other leaders in various provinces motivated to do a bit more than what we have given them as a target, our real desire to have 70% of the 40 million by December is possibly going to be there. The progress to mobilize, there's a request by, are we going to do to all provinces? There was a report tabled in the NCCC to say, while we look at Gauteng as having done fairly well, but Gauteng is a very populous province, it should do better and faster than the rest of us. So that is what we went to motivate them for that, to say, look, the numbers are coming in, but there are certain parts of Gauteng, Setiben, West Rand, they are not doing as well as Tshwane and Johannesburg. So we were motivated, and every lane also is not that high, but they are also trying. So we want to push those 3 other districts to do just as well as Tshwane and Johannesburg. We will, like we are coming in from Northwest, we are also identifying areas in Northwest that are not that doing well. And of course, for various reasons, logistics, farm workers, farmers, rural areas, difficult to find, informal settlement. Very interestingly, we went into another area, Ketleng, where we found that people are just not having IDs. Now, fortunately, there was a truck there that was giving people IDs, but if you get to register an ID today, you will not necessarily be vaccinated today. But however, if your ID was because it was a lost one, as soon as they put you into the system with that number that you get, because you're already in the system, you can then get vaccinated. So some of the areas we still have to work out as to what do we do with South Africans, and maybe people who may not be South Africans, but who are within the country without IDs. Do you vaccinate them? And if you do, where do you get that data? How do you do that? Because our system is such that it is linked to the ID registration. So that part will be worked out by the Department of Health together with the Department of Home Affairs. The issue of vaccine hesitancy, again, Dr. Jacobs, the chair, is asking it, and maybe it is a topical issue. Dr. Crisp, maybe in your responses, you can maybe expand a bit more, because about 3 honorable members are asking about this matter. Are we dealing with it decisively? Do we notice it? What is the plan going forward? But I hope maybe the answer to Dr. Jacobs has been fairly answered about, are we dealing with the 58 million or are we talking about the 40 million? Is it a 70% of 40 million or 70% of 58 million? If maybe I would allow Dr. Nicholas Crisp to add and answer some of the questions I have left out. Thank you, Chair.
Thank you very much, Dr. Crisp.
Chair, thank you very much. I won't go over any of the ground that the DM has already covered, so I'll just address those that he's asked me to cover. So let's start with the question of what were described as harmful events. So there's a process called Adverse Events Following Immunization, AEFI. This is a global program that is we have been running in South Africa for childhood vaccines for many years, more than 15 years. And we use that same process globally for these new vaccines for COVID. So it is a reporting structure. The reports on any adverse event that is identified by a practitioner or even by a lay member of the public who feels they would like to notify it can be done either on an app on the phone or by email reporting to either the National Institute of Communicable Diseases or the Department of Health or the South African Health Product Regulatory Authority, or by just notifying us by email, and then we will contact the individuals to follow up on the information. Now, adverse events can be mild, but still adverse. In other words, bad for you, causing harm. That harm might be temporary or transitional, but it might be permanent. And even if it's temporary, it might be serious. So we talk about serious adverse events following immunization. Clearly, the worst and most serious of those would be death. So what happens is that this program has teams of professionals that are trained in this examination and investigation of adverse events in every province. There's also a national committee appointed by the minister called NICEC, the national committee that deals with vaccination events. And they have a process. It's a standard process that we follow. As I said, it's a WHO global process, where evaluation is done of all adverse events to determine whether they were caused by the vaccine. In other words, not are they associated with in terms of time or just happen to be around the time of the vaccination taking place, but were the adverse events or the harm done to the individual caused by the vaccine? Now, they may have been caused by the vaccination process, such as an abscess, but not necessarily by the vaccine itself. We report from that system into the global collective information so that we are watching what happens all over the world and can inform ourselves about what might be harmful from vaccines. Now, our reporting was presented 2 or 3 weeks ago during one of the Minister's Friday press briefings, and followed by its own press briefing by SAHPRA, our regulator, South African Health Products Regulatory Authority. They have the statutory mandate for reporting on what we call pharmacovigilance, or anything to do with any medicine or drug or biological, which a vaccine is, that might cause harm for any reason. That website is now in the public domain. It is a mini website. If you will go to the SAPRA website, sapra.org.za, and there are listed the tables of all the adverse events that have been reported so far, including the deaths. And we have had reported after vaccination around about, I'm not sure as of today, but more than 60 deaths. And more than half of those have been investigated, and the investigations are concluded. And none of the investigations that is concluded so far could be found to be causally linked. Could the death be found to be causally linked to the vaccine? So it's quite a rigorous process, and I think people can look at the information and feel comfortable that there's a process. And if you feel that it is not being adequately dealt with, then you can raise it with any of the authorities and we'll follow it up. Now, should a harmful event, whether it is transitory or permanent, and whether it be death or whether it be something like a disability, be caused by, not associated with, but caused by a vaccine, and this particular vaccine, we do have a program called the No-Fault Compensation Fund and the No-Fault Compensation Scheme. So far, we have not had any of these adverse events that have got that far in the process. But should that be the case, they will go through to that no-fault compensation adjudication. And there are various panels associated with that. And there's an outcome will be given. An award can be made, and Treasury has set aside money for awards to be made. And should the award be turned down, there will also be an appeal process. So there have been regulations published. We are busy revising those regulations to simplify them. And in due course, they will be published again in the Gazette. So we do have a process. We do take this very seriously, but so far it's not been an issue. Just one thing to add to what the DM said about the under 18 vaccinations. It was mentioned in the question by the Honorable Geller that other countries are vaccinating under 18. It is true, but those countries that are vaccinating under 18 have already reached a far higher percentage of vaccination coverage than we have. They are months ahead of us in terms of their programs. So I have no doubt that at some point in the future, we will have a vaccination program that is able to roll out to minors. And in the countries that were referred to, the ages 12 to 17, we don't have vaccines for use under the age of 12 any in the world at the moment, but there are programs, research programs going on looking at the efficacy and safety of vaccines between the ages of 2 and 12. And that may come in the future as well. But for now, we are definitely not there. Our most pressing challenge at the moment is to find people and convince people that vaccination is good for you. As the Honorable Chair said, I made a pretty clear case for what happened on the 5th of September. And over time, we will give you more information to try and convince people that if you are vaccinated, your chance of entering a hospital and ending up in serious trouble in the hospital or even dying is dramatically reduced. Our challenge is to get people to vaccines and to get vaccines to people. Otherwise, we're okay for now. There were questions about spoiled vaccines. In the normal course of any vaccination program globally, we do have what's called planned wastage. And that is where a vial might contain 5, or in our case with Pfizer, 6 doses in a vial. And at the end of the day, a vial is opened and only 3 vaccines are given and 3 need to be thrown away because you can't find people to vaccinate with them. That is part of planned wastage. But when the cold chain is compromised, or in other words, the refrigeration is not optimal, and you can't prove that this vaccine has been refrigerated the whole way in its whole life before it gets to people, we do sometimes have to throw away vaccines. So far, I'm aware of 2 instances, and collectively, those doses are under 10,000 doses that I'm aware of. That's not to say there may not be other smaller amounts, and we'll certainly do some homework to check what that number is of vaccines that have been destroyed due to failure of the cold chain. As far as medications being contraindicated to Pfizer vaccine, as I said, we collect information globally about any contraindications, which might be another medication. It might be somebody who's immunocompromised because they're on cancer therapy or whatever. When those informations become available, we publish them. They are not done by the Department of Health, but by the technical experts in the advisory committees appointed by the minister. They then advise the minister, and when we get those advisories, we publish the contents either in circulars to our staff, if that's what's appropriate, or onto either the department's website or SAHPRA's website, whichever is appropriate to the information that is being published. In the case of contraindications to medicines, it's usually the regulator where we would do that. I was concerned that the Honorable Themba Kwayo thought that the minister had said that he wanted to limit access to public facilities. He, in fact, very pointedly told me we will never limit access to public facilities, and that should there be, through any statutory or legal or court process, limitations to other facilities, it would be highly inappropriate to limit access to public facilities. So that, all I can say is that was the instruction and the discussion that I had with the minister about whether to use vaccine cards to limit access to anywhere. As far as hesitancy is concerned, Chair, as the DM said, several people have raised this with us. So what we've been trying to understand is there seem to be two different kinds of what are being called hesitancy. The one is more about, the word that was used in discussions is laziness. So, or just not getting going. So people, they know that vaccines are there, they know they're good for you, they know they should go and get vaccinated, but it's an effort. So there's a large group of people for whom the effort might just be a bit much. And then there are people who are hesitant because they have actively engaged with messaging that might be negative. They may have been put off because they don't like needles, or for whatever reason, they are hesitant to go for a vaccination. And then there are those that are just out and out, the 6%, according to the surveys we've been looking at, who out and out are absolutely against vaccination. So our challenge is to get the people who are just not inspired to come for vaccination and to provide information to those who are hesitant, the real information, so that they are able to make a confirmed and proactive decision before they get sick and end up in hospital. And then just to the last question that the Honourable Deputy Minister asked me to clarify is the question of our targets. So ideally, the first target is to get 70% of people over the age of 50 vaccinated. In fact, we'd like to have every single person over the age of 50 vaccinated, because these are the most vulnerable people in the community who are definitely at risk of ending up in intensive care unit and of dying. So we have that as a target. But for this year, the target for the vaccination program, by the time we try and get ourselves a break and a breather for Christmas and at least try and get some life back, the Department of Health would like to concentrate on adults. And the adult population we are looking at is the 40 million we were referring to. And we are, for this year, this calendar year, trying to get to 70% of the adult population. That is not the last target. We still would like to get to the entire population, including the children. But if you've already excluded 20 million people from your target program, you can't hope to reach them. And you will never reach 100% of people, because in our right minds, we know that there are people who are more than hesitant, but will refuse to be vaccinated. So realistically, if we look at countries around the world who are ahead of us, anybody who gets beyond 65% of their population vaccinated has done extremely well. And some of those countries do it in quite, I don't want to call it forceful, but more forceful than we have been with our vaccination program. We would prefer to encourage people and provide information. So, Chair, our program is we would like to vaccinate with at least one dose 70% of the adult population by Christmas. We know that that will require us to do in excess of 260,000 vaccinations every day from now until the end of the year. And we would really like, and we have the capacity between us in the public and the private sector to reach 300,000 vaccinations per day, which is the target that the president has set us. If we can do that with the help that was referred to by Honorable Sukacha and others, I believe that if we pull together as a nation, that is doable. Thank you, Chair.
Chairperson, if you can allow Dr. Berikis Nasami, who's part of our delegation, he has some information that he can add on with regards to vaccination at workplace and mandatory or non-mandatory. Dr. Kisnasamy, please, if the chairperson allows you.
Certainly, Dr. Sibongiseni. I was going to ask if any other members of the delegation wanted to say anything. You're very welcome, Dr. Kisnasamy.
Thanks, Chair. I'm having some data problems, so I'm not going to put on my camera if it's okay. So I do apologize to honourable members via you, Chair. Thanks, Deputy Minister. Mr. Chair, can you hear me?
I can hear you very well. Please continue. Thank you.
Okay. Now, thanks to the Deputy Minister and the acting DG. So just on the issue of mandatory vaccinations in the workplace, so Deputy Minister was correct. Government has not pronounced on it. The whole issue around mandatory vaccinations in the workplace is covered under the Occupational Health and Safety Act, which is covered by the Department of Employment and Labour. And the Minister of Employment and Labour issued a direction notice at the end of May on a whole lot of workplace measures in prevention and interventions on the COVID-19 response for workers. And then Annexure C of the direction, and we can make that available to via Mr. Cutler to your office, Chairperson, in terms of it. And that's the Annexure C, which covers the issue of workplace vaccinations. And it's a very regimented process. This was discussed at NEDLAC, where, as Chairperson knows, the government, trade unions, business and community is present. And based on that process, in terms of the NEDLAC process, ultimately it went through the Minister's office in the Department of Employment and Labour. And it really covers a very strict process of risk profiling the workplace, risk profiling the jobs, and then ensuring which job would need to be a mandatory vaccinated job, and thereafter consulting with the workers, etc. Of course, there's still grounds in terms of the issue around medical grounds, religious grounds, etc. But the constitutional provisions here are still to be tested. But I guess because the state law advisors were involved as well in terms of this process. So it's strictly about transmission risk in the workplace, either to consumers, clients, customers, or the individual, or to other workers in the workplace. And secondly, there's a procedure involved in terms of what you should do, including counseling with the workers, providing them support, and providing an enabling environment. So thanks, Deputy Minister, for allowing me to make that input. So this is an employment and labor direction under the Department of Employment and Labor under the Occupational Health and Safety Act. Thanks, Chairperson.
Thank you very much, Dr. Kisnasamy. Dr. Dlomo, anyone else to say anything? As we're about to close, maybe yourself?
Yeah, okay. No, on my side is to just invite the honorable members. Of course, we have given you an update, but we do this one again to the country at 7:30 tomorrow. That will be broadcast in most of the television stations. But what would be interesting, the Honorable Chair, is that there will be a presentation made specifically by the MEC of Health in the Northwest. So we will be focusing, among other presentations, to what challenges does Northwest have in going forward in terms of giving that. There will be another very interesting short presentation of a testimony by a senior political journalist who actually has agreed to give and share her story with us. So if honorable members are able to join in, the login details will be forwarded to Ms. Majalamba, but again, some of that comes in straight into the into the national media. That's all that we have, Honorable Chair. Thank you very much.
Thank you very much, Dr. Dloman, all of the the representatives from the Department of Health. We appreciate you coming again tonight to brief the Portfolio Committee on Health on the vaccine rollout and vaccine acquisitions. We want to give a message to the people of South Africa to please go out there and be vaccinated. The question that we raised was specifically about hesitancy, and we have spent quite a bit of time on trying to address the hesitancy with the people of South Africa. I'm also very thankful that you had raised what kind of or types of people do not want to be vaccinated. And I hope that the data given in terms of one's risk of being hospitalized or becoming infected, then being hospitalized, and then landing up in ICU, and maybe as Dr. Roma said, not coming out of the ICU, is so much higher than in those who are not vaccinated and those who are vaccinated. And I felt that I should actually put that out there again this evening and really request the people of South Africa to bring themselves forward to be vaccinated. Thank you very much to everyone who has joined us for this meeting tonight. Thank you very much, honorable members, for your participation and the participation of Dr. Gloma and the representatives from the department. This meeting, just before I close the meeting, please be reminded at 9 o'clock tomorrow, we are having public hearings on the NHI starting at 9 o'clock. We are having 3 organizations, the Black Business Council, the Active Citizens Movement, and the Lawyers for Human Rights. And then after that, we're having the adoption of minutes. So please, if you can join at least 10-15 minutes earlier for tomorrow morning's meeting at 9 o'clock. Thank you very much. Good night to everyone.
Good night.
Good night, Chair. Thank
Good
you.
night.